Hey guys, Naudi of Functional Patterns. I'm going to teach you guys how to release your quadriceps with the medicine ball. Again, great tool for myofascial release. As I talked about it before, I want you guys using a medicine ball instead of a foam roller eventually. You can start off on a foam roller, but I want you guys on a medicine ball. It's a harder surface. It pinpoints areas that the foam roller can, and this will actually correct its function for permanently. A foam roller will not. So this is where I want you guys progressing to as you go along within your myofascial release regimens. Okay, so what we want to do is go over the top of the thigh and drop down to our elbows like if we're doing a plank. Now for those of you who lack core strength and can't really do much in this position, just keep the opposite knee down. So I'll go to the other side so you guys can kind of see what I'm doing. So this knee can kind of come down and we can alleviate pressure from there, because sometimes this may seem like it's a little too intense. Now the quadriceps usually begin to overcompensate because the glutes don't work anymore. If glutes don't work anymore because you have tight hip flexors, those quadriceps have to begin to compensate. And again, compensation leads to poor balance, poor mechanics, and then eventually that can lead to major pain as you get older. Again, we roll around until we find a painful spot. We don't run away from this discomfort, guys. We go straight to it. We tackle it head on. In this circumstance, pain usually doesn't lead to gain. With most circumstances, pain usually doesn't lead to gain. Roll over that top of the quad. You can get all the way down to the knee, right to where the stabilizers of the muscle are. And remember, the quadriceps are round. You have your vastus lateralis, vastus medialis, you have your vastus intermedius, which is in the middle, you got your rectus femoris, which is on top. So there's like a round circumference of that quadriceps. You can get a little bit on the outside. Like right now, my body's leaned a little bit to the outer part, and I'm on vastus lateralis, which is that muscle on the outside. But then all at the same time, I can shift that over, get onto rectus femoris, which is actually one of the hip flexors, along with one of the quadriceps, which is right here on the center of the thigh. So we can get directly over the top of that. Or we can go into the vastus medialis, which is more on the inner part of the thigh. So I would kind of almost like turn my hip slightly outward and get on the part that's on the inner part of the knee, right around there. Okay, so there's multiple portions to that quadricep. We just have to make sure that we get to all of them, that way we get full efficiency. Right. That's how we release the quadriceps. If you'd like to learn more about what I do, subscribe to my channel or visit www.functionalpatterns.com. Take care.